Hello, everyone, and welcome to Faces of Digital Health, which is originally a podcast about digital health and how healthcare systems around the world adopt technology, but since recently also a YouTube channel where all the podcast interviews are also published in a video form. I'm very excited to share today's episode with you with two speakers from Brazil. You're going to hear from the President of Beaba, Simone Mozzilli, and the Strategy Officer, Liliane Dubois. Beaba is a non-profit organization that's working on demystifying cancer-related treatments and everything patients, especially children, need to know when they're dealing with the disease. Beaba, as mentioned, is a non-profit organization that offers various sorts of information through an app, through a podcast, through a book, and the solutions are actually present all across the world, starting with South America, US, South Africa, Europe, and elsewhere. So in the following discussion, you're going to learn a little bit about how support for children and their families looks like when they're dealing with cancer treatment, and what exactly does it mean to bring information closer to children. Before we begin, in case you're interested in other episodes as well and hearing from speakers all across the world, go to our website, www.facesofdigitalhealth. I'm very happy that Faces of Digital Health is a proud member of the Health Podcast Network. So in case you're interested in exploring the horizons from different speakers, different podcasters around various topics from the nursing perspective, physician perspective, perspective about digital health and various other topics, go to the Health Podcast Network's website as well. Now enjoy the show, and if you will enjoy the discussion, do check out other episodes as well and subscribe to the channel. Liliane, Simone, welcome to Faces of Digital Health, and I'm very excited to hear how you're working in the field of cancer for children. It's very rare, actually, that we talk about topics that concern children. So let's see what Beaba does. You describe yourself as a company demystifying cancer and informing about it in a clear, objective, and optimistic way regarding treatment, regarding the disease. How exactly do you do that? Simone, maybe you can start.
Yes, hello everybody. Thank you for the invite. So we demystify the disease, the treatment, and the oncology environment throughout a methodology we've recreated using the principles of information architecture and design, usability and human-centered design. There are a lot of things which we pay attention to, such as visual and textual information like target, clarity, images, colors. For example, if we will show an image in a difficult context, we avoid using red because we know, studies shows, that this color accelerates the heartbeats. So that's our job.
Mm-hmm. And how exactly does the demystifying take place? Is it through an app or other means as well? Because the impact of color sounds fascinating. Can you perhaps mention any other examples of what does it happen when you use the usability and human-centered design?
Yes, we use several approaches in order to demystify cancer, and we do it through different platforms such as online, through an app with 20 mini games, social networks as Instagram, Facebook, and also courses for health professionals. Offline things like Beabook, Beaba camping, workshops, and meetings. About what we apply from usability and human-centered design are in Beabook, when we write about cancer term, a lot of terms, we always finish the sentence with a good word of encouragement. In Beaba camping, we use gamification to influence them to do things they are not like, such as try to eat broccoli and go to talk psychologist. Many things that the patients never did before and start to love. I think in a few words, demystify is also to encourage people to try or discover things they have never done.
So the field that you're covering is very specific, and maybe if we go a little bit back to the beginning of the story, how exactly and why, was Beaba created? I'm sure that there's a personal story or a connection that kind of drove you to do this.
Yes, a long time ago, not so long, but for many years I had volunteered with children with cancer. And despite my background in information technology, because I'm graduated in communication, I didn't know how to explain to children about the disease and the treatment. Until 10 years ago, I was diagnosed with ovarian cancer. And I realized that the most of the materials didn't represent and much less engage the patients. And during my treatment, I started to talk about the disease, the treatment, the oncology ward, and I talked with children. And this motivated us to understand and share like our procedures, fears, difficulties, and discoveries. So we founded Beaba, which is a non-profit organization made up with patients, health professionals, and technology professionals. So I think Beaba it's my soul, my heart.
You mentioned that you got sick after you already started Beaba. So how did that experience change your perspective and impact the future development of Beaba? Did the course change? Did your approach change?
Yes, I had cancer before starting Beaba, but after starting volunteers with children with cancer. And I felt at the same time grateful for learning so much with the patients, the children, about how to face the treatment. But the other hand, I was afraid because the information and the support tools were not suitable. They did not give clear information or even help me to face the treatment. Uh, that encouraged me to create better material for us, the patients.
Beaba is actually a non-profit organization, and as we mentioned, the aim is to demystify cancer by providing the information in a more clear or just light is not the right word, but just in a perspective that also has a positive, optimistic way about it. It's for children, it's for adolescents and their caregivers. And I wonder what was the thing that you identified as the biggest need in children's patient care with cancer?
Well, I think I can get this one because I had cancer while I was a children, a young one. I had with when I was 7 years old. And I can say normally people think that the most important thing for patient care is the treatment. But as a former patient, we can answer that actually that the most important thing after a cancer diagnosis is having the correct and clear information about everything you are going to handle from that day on. Because in one day, your whole world changes and you become a person with cancer. And with all the difficulties, and you will have to face it beyond learning everything you have to learn about the disease, the treatment, the way of living this new life, etc. So you have to learn everything about this whole new world and also teach your family and friends about it. And it is much better to get this information in a clear and optimistic way.
And so the whole design and everything that's produced by Beaba has a very kind of a cute design about it that gives you a little bit of a warm, fuzzy feeling. That was at least my impression. But I also started wondering, what about when the news or prognosis is not so optimistic? I understand that, patients need a lot of positive attitude and positive energy, but what about, when things do not look that good? Do you address that as well?
Yeah, actually, we think that the first thing is that people need to learn how to live with cancer, independent of their prognosis. So as we don't know for how long we are going to be in treatment or if we are ever going to be cured, that is why we want people to have the best life they can during each day of the treatment. So this is the optimistic point of view, not only to believe that we are going to be cured, but the most important is to believe that we are having the best quality of life during all the journey. So normally people expect that you are going to receive your diagnosis, pause your life, and only live as a sick person until the cure or the death. This is the pessimistic way of living, we think. So as we don't know the day after tomorrow, we have to learn how to live the best with the cancer. So still getting the best life with this condition can provide. This is the optimistic vision for us.
Mm-hmm. I think there's still a lot of people that are going to associate cancer with death. So one thing that I try to explore, through the podcast is how different cultures around the world adopt technologies, approach problems, what are the cultural attitudes towards different topics. And in this way, given that Beaba is present in South America, in the US, in South Africa, all over the world, I do wonder, do you see that fears and worries across the countries differ in any way?
We understand that the fears and concerns are the same in different cultures. Perhaps what changes is the way we deal with it. So Brazilian people are very optimistic by nature and in general prefer to deal with that way, believing that in the end everything will work out, will be okay. So we brought this optimistic way to the communication of our materials, and we realized how well it was received in different other cultures and countries. Everyone wants to believe that they will be fine. The most important thing is how to go through this all over the treatment. So each day matters for those who are facing cancer. So this is our focus, to help people to understand the cancer world and how to improve the quality of life during treatment.
Perhaps additional question to that, Beaba is based in Brazil. You talked a little bit about the nature of the people and their attitudes towards life, but what about the healthcare system and patient cancer care in Brazil? Can you mention any challenges or the upsides, the good points of care?
We can say Brazil is a country with a huge social differences and all the challenges that this implies, mainly economic and educational. On the other hand, Brazil is also a world reference with its public health system called SUS, which is far from the ideal and has many management challenges to solve, but it guarantees access to adequate treatment for many people who would not be able ever to afford it. Unlike the US, for example, where families need to put their homes in mortgage to pay for the treatment. In Brazil, those who are able to obtain an early diagnosis and access to the major public health treatment centers have this privilege. So I was one of them. I was took care in a public health center. So despite all criticisms of Brazilian public health, I owe my life to it, so as do thousands of other patients. That is why we have to defend its maintenance and improvement of this public health management. So in short, Brazil has excellent public hospitals and highly trained professionals, but unfortunately, this reality still cannot reach the most distant regions and the poorest population. So other than that, we can say that the general problem of the patients in Brazil, even from the public or the private system, is the same as in almost all countries: the lack of adequate information and humanization of the treatment.
Speaking of information, which is exactly what Beaba provides, you mentioned before that the fears and worries don't differ much around countries. But given that the app is available across the world, how much did you have to adapt the content based on the culture?
The app is in Portuguese and English. We would like to use in all different language, but we still don't have all the adaptations needed to many countries. But we try to develop it since the beginning in a more transcultural way. We really want to adapt it for different cultures, but we need to have financial support. So if you are listening and you want to be a sponsor, now it's the time.
We'll definitely add the link to the company and everything that you're doing in the show notes. And while we're talking about everything that you do, you actually offer a range of products to people to be better informed, so people can listen to podcasts. You have an app. It all started though with the printed guide for children, which was designed in collaboration with children with cancer. Can you tell me a little bit more about what kind of information is in the guide? Very
Yes, the
specific, yeah.
guide is this is Beabook. It's be a book, but it's in Portuguese. Beaba. Beaba. It's like ABC. B. How you say Beaba? Yes, in Portuguese it's beaba. It's like B plus A is be, beaba. And in English we say Beabook. It's like a dictionary with which explain more than now it's 150 terms about cancer, and all the terms are nicely illustrated and very fun and joyful in a easy way for children and families to learn about. And Beabook also helps the health professionals to explain the treatment and the procedures to the children and the caregivers, and helps everybody to be more prepared and empowered to face the treatment. We just got the third edition, and we will donate 6,000 books from over Brazil. Uh, it's already translated to English and Spanish, and we are looking for partners to help to distribute them in other countries. So, hello again.
Another call to action. One thing I wonder is children are very curious. I'm sure that, when you work as a volunteer, they often ask, why is this like this? Why is that like that? So, to which extent do children with Beaba get all the information that the adult would? And how do you adapt the information delivery so it's for children?
Children are smarter than we think, and they can understand everything that is going on around. So they feel their bodies, perceiving the changes and experience the pain, especially in cancer treatments, because everything is getting different from the day one. So where the journey is very long. So if you go to a hospital, you are going to see children playing with dolls in the exact same way as what they see people doing with them, the nurses and the doctors. So they pay attention to everything and copy that on their gameplay. So I can say it about my experience, because I had cancer when I was 7, and one of my favorite plays was taking care of my dolls and even my parents. So giving them fake injections and changing wound dressings, everything that I lived in my reality. So Beaba learned how to adapt the information with specialized professionals and the children themselves. Children want to know the truth. That's, I think, is the first action. They want to be part of the treatment, and what we do is adapt this information in a way that is easier for them to understand, and also the family. So we use a simple and objective writing directed to children, as well as figures to help to illustrate the texts. So every detail of Beabook is very precisely thought out. So like format, colors, material, everything has a purpose.
You mentioned that, obviously family is very involved in this whole process, which kind of got me thinking that we do, talk about children and the patient and how to help the patient, but maybe with children, even more as with adults, it's not just the patient that suffers or goes through a very difficult experience, it's the whole family that, quote unquote, gets sick. So how do you see the support needed for the whole family, the parents? Are you looking in that realms as well with Beaba?
Beaba understand that cancer education has to be done for all the participants of the ecosystem. So from the patient to the health professionals team. So the Beabook, for example, is used not only by the children, but also by the families and caregivers, since everyone needs to step in on this topic with an easy information. So, and also the health professionals also use it to standardize the communication with the families and the children, learning the best way to make it self-understood to them, to the families and caregivers. So it's education for the whole ecosystem.
Mm-hmm. A few years ago, you also designed a game. It's called Alpha Beat Cancer, and it aims to bring relevant information to young children through gamification. So gamification is definitely something that's widely explored, especially when it comes to encouraging healthy lifestyle or presenting information in a more engaging way. So can you talk a little bit more about the app? What has it taught you about the approaches, about the way that information is best delivered to children?
Alphabet Cancer is an educational app developed with Mukutu. Mukutu is a game studio led by Ludmila, a friend of mine who had cancer too. And the app is about cancer and the treatment, designed to serve as a learning tool for children diagnosed with the disease. I think the main goal is to provide information through the challenge and recreation, using the principles of information technology combined with design, usability, gamification, and user experience. And the content of the app came from Beabook and uses a linear narrative presenting and following the path of the treatment, like symptoms, diagnosis, and treatment itself, counting logical support of time, space, and characters. And at the same time, the user takes over the patient. They also control procedures such as biopsies, application of radiotherapy, and patient care in order to encourage identification with the character and his or her own treatment. And this way, I think the passivity is reduced and the patient is encouraged to take control over the real situation.
Mm-hmm. And I'm assuming that the app was designed and tested with various stakeholders, right? Is it still 20 mini games?
Yes. 20 mini games that bring entertainment and information. And the development was made with effective participation of all the stakeholders, like patients, caregivers, and health professionals. And I think this strongly motivated us to stay strong and keep moving forward down the path. And it's help for everybody.
Do you by any chance have any plans to extend it? How is it with updates? Usually when you have games, the players are very hungry for new chapters.
Yes, I'm sure. We would love to add many other games to dog along with all treatment phases. This is the idea for next steps, but unfortunately, we did not have more financial support to continue the game development. And we can hope we can get a sponsor in the future to update and upgrade the game and other new games.
Liliane and Simone, thank you very much, for all the information that you provided and for everything that you're doing. It's very inspiring, and I don't say this very often, I must admit, but I will definitely add all the.
Can you repeat? But it's recorded. Okay, it's recorded. That you don't
Yes,
say this very often, so I need this phrase. Maybe in
yeah,
my
yeah.
wall.
Yeah, it's really very amazing. So yeah, I definitely encourage, all the audience, all the listeners to check out your website, and the link is in the show notes. And good luck with your further development. Thank you for coming to the show.
Thank you.
Thank
Thank
you
you.
so
Can
much,
you say
Cosmo.
hello, oi Brasil?
Hello, oi Brazil.
Yes.